Hi, everybody. We are going to continue with our skeletal system lecture. This is part 4. We are going to describe the type of bone fractures, take a look at some of the pictures, and then also look at some of the medical conditions associated with the skeletal system. So first of all, there are two ways of classifying the typical fracture. You can be classified as either simple or compound fracture. Simple simply means that the bone does not penetrate the skin, versus compound fracture implies that the bone, the broken piece of bone protrudes out of the skin. If you are to basically treat a fracture, you do need to do reduction, or the process referred to as reduction. If the fracture reduction requires surgery, we identify that as open reduction. However, for setting up the bone and ensuring the bone is aligned, does not require surgery, like when you break your nasal bone, that's called the closed reduction. Now, in general, we have total of 6 type of fractures. Are these the only type of fractures we have? The answer is no, but these are the most common type of fractures that you can see on a day-to-day, as a result of day-to-day activities. So, depressed fracture. Depressed fracture is a result of typically a piece of bone, like the bone of the skull, being pushed inside a cavity. This is very typical in the skull as a result of blood force trauma, and you can see it clearly on the X-ray, the very severe blood force trauma that caused the depressed fracture in that individual. Spiral fracture, on the other hand, is the type of fracture that is common in athletes. Kind of imagine a person is moving in forward and somebody put a lateral force on the bones of that individual. So you have two bones basically clash, and two forces clashing with each other, which causes the bone to twist, and that twisting motion creates what we identify as spiral fracture. Again, this type of fracture is very common in athletes, typically through contact sports. The next type of fracture, called comminuted fracture, which again you can see in an X-ray. This is where the bone usually shatters to multiple pieces. A typical fracture, you end up with 2 pieces. However, again, if you have 3 or more pieces of the bone present during the fracture, as a result of a fracture, then that is referred to as the comminuted fracture. Comminuted fracture is extremely common in elderly, as they have bones that are more susceptible to osteoporosis, and therefore they have brittle bone overall. The next type of fractures we have is called compression fracture. Now, as the name implies, compression fracture is literally where your bone is collapsing on itself as a result of, again, some sort of drastic trauma like falling. You can see in this picture that you have your lumbar 4. Look at the thickness of the bone and look at the bone right on top of that. Again, that bone is clearly collapsed on itself and making this a compression fracture. The part of the skeletal system that is most susceptible to that would be your vertebral column. Another type of fracture we have is called the epiphyseal fracture. Now, as the name implies, this fracture is associated with your epiphyseal line. Recall that your epiphyseal line is made up of chondrocytes, or basically cartilage cells. So if there is some sort of condition where it causes the cartilage cells to die, then it is relatively easy to separate the diaphysis from the epiphysis. This type of fracture also, again, would be very visible. You can see the epiphyses in the X-ray clearly separated from the diaphysis of the bone. Last type of fracture that you have is common in children, is known as green stick fracture. The reason this is called green stick is because if you have ever tried to break a piece of green stick, it's hard to break. It usually bends, but it doesn't break. So it is the same thing in children's bone. Because they don't still have as high concentration of calcium and phosphate deposited in their bony matrix, these bones are not as hard. So instead of breaking, part of the bone actually bends, and while the other side may break. So hence the name green stick fracture. Um, and again, the main reasons, if I said who's susceptible to this type of fracture, the answer is children, because their bone are more flexible because of lack of, not lack of, a lower concentration of calcium and phosphate within the matrix. We already took a look at this when we looked at the skeletal system in our lab, but kind of a review of that. Within your skull, you have what we identify as sinuses. These are associated with the frontal bone, called the frontal sinus, the ethmoid bone, called ethmoid sinus. If it's associated with a sphenoid bone, called sphenoidal or a sphenoid sinus. And lastly, if it's associated with your maxilla, depicted in blue, that would be your maxillary or maxillary sinus. Now, I don't want you guys to spend a lot of time in the cranial and facial bone for the lecture, as we spend significant amount of time in the lab discussing this. We also talked about sutures, which are basically immovable joints that holds the skull bones together. In terms of the vertebral column, we have total of 26 vertebral bone. These are separated by intervertebral disc. If I ask you what type of cartilage is the intervertebral disc, you should recall that this was fibrocartilaginous or fibrocartilage, which was relatively tough and deal pretty well with stress or tension. The weight of the body is located on the the vertebral column extends from the skull to the pelvic bone, and it allows for the transmission of the weight of the trunk to lower limbs. It is also a main support for the body's axis, and the main function of that is protection of your spinal cord. We also looked at this in your lab. We saw that the processes that extends from the vertebra are also points of attachments for both the ribs as well as the rib muscles. Now, one of the reasons that we have talked about fractures is how your body actually deals with a fracture. So typically, if you break a bone, you have the cast on that bone, if possible to cast it, is about 8 weeks or 2 months, which is a relatively fast recovery time. Now, how does the bone recover? We have it very simply described here. It's not as simple as it's depicted again in this picture, but for our purpose and for our class, this is all I want you guys to know. When a bone breaks, you have a hematoma forming because your bone is rich in blood vessels. So basically, if you break those blood vessels and damage it, you basically will have bleeding inside the bone and eventually formation of clots. After that, you have your bone creates something called a fibrocartilaginous callus. This is a relatively hard structure. Of course, it's not going to be as hard as the actual bone, but it is hard enough that it allows the tissue to start to heal itself. Eventually, the fibrocartilaginous tissue gave rise to the bony callus, and the bony callus eventually gets remodeled to form the bone that to heal or complete the process of um, recovering from a fracture. So for the exam, again, we're going to keep it simple. Know the steps as formation of the hematoma as a result of the fracture, eventually development of what we identify as fibrocartilaginous callus. Third step is formation of bony callus, and lastly, remodeling of the bone to finish the process. Now, moving to some of the medical conditions associated with the skeletal muscle, the most common that you'll see nowadays is osteoporosis. Osteoporosis is basically where you have your bone matrix starts to decline because you have a high rate of resorption compared to your deposition. Basically, what it means is you break down the bone at a faster rate compared to adding the new matrix. So you can see when you compare the top picture, which is the normal tuberculi of the spongy bone versus the bone that has osteoporosis, it feels or it seems to me like a group of termites have attacked and literally ate through your bone. So you can imagine this bone would be very fragile and susceptible to fractures. So bones that are typically susceptible and are affected is where you have the weight of the body on it, and that includes the vertebra as well as your hip bone. So individuals that have osteoporosis must be very careful because a fall can cause severe fractures in their bones. Now, who are the persons that are at high risk of osteoporosis? Basically, if you get old, you are at risk of developing osteoporosis. So let's look at some of the statistics. About 30% of the women in age of 30 to 70, and 70% of people above the age of 80 will have osteoporosis. Typically, if you have given birth, your osteoporosis, you actually will have osteoporosis because the child, in many cases, takes some of the deposits of the calcium during the fetal development. 30% of the Caucasian women will fracture their hip bone, or sorry, they fracture their bones as a result of osteoporosis. And the main reason for women, when compare women to men, women have a higher risk of developing osteoporosis is because after menopause, the level of estrogen will decrease significantly, and estrogen plays a main role in maintaining your bone density. So when that bone density declines, when the estrogen level declines after menopause, then the bone density also starts to give away and making the women more susceptible to osteoporosis. In case of men, the reason men are not as susceptible to osteoporosis is because they still produce testosterone. Of course, not as high as when they are at the younger age, but they still relatively normal level of testosterone helps protect men against osteoporosis. Some of the other risk factors that can also lead to osteoporosis, you have patients that are relatively petite. They have those individuals that are living a sedentary lifestyle with very insufficient exercises or significant amount of stress on their bone. People who have poor diet in terms of calcium levels or proteins. If they are smokers, if you have a variation or changes in the hormone levels like hyperthyroidism, where your thyroid gland is not working properly, You can have low blood levels of the thyroid stimulating hormone, which also has an effect on osteoporosis. I'm not going to go into detail about that. You'll go over this in much more detail in endocrine system next semester. And if you are diabetic, you're also more susceptible to osteoporosis. Immobility, again, if you are bedridden, the bones are more susceptible to osteoporosis. And if you are a male and taking medication that suppresses the testosterone level, so I should backtrack. Male that have a prostate cancer and take medication to suppress androgen suppressing hormone, like medication that basically limits the testosterone level in the blood. Those individuals are also going to be more susceptible to osteoporosis. Now, what is the possible way of treating as well as preventing osteoporosis? Now, prevention is always the key, right? You want to prevent it rather than treat something. Prevention, think about this logically, guys. The more calcium you have in your system, the more of that calcium has the ability to, or the less likely that your body will tap into the calcium storage within your bones, therefore the less chance of developing osteoporosis. Reducing consumptions of carbonated beverages and alcohol. Carbonated beverage and alcohol literally leach off of your bones, and that also leads to decrease in bone density. And the last one, which is kind of, again, the logical one, we have talked about it in terms of Wolff's Law earlier, is weight-bearing exercises. The more you lift weight, do resistance training, the stronger your muscles are, and that increase in the muscle mass forces your body to remodel the bone to deal with the extra weight. And the less exercise you do, the more likely you are to develop osteoporosis, because your bones become basically they don't have to do or support significant muscle mass, and therefore decline in their strength. Now, if an individual has developed osteoporosis, what are the common treatments? Again, logically, give them calcium so they won't tap into the already low level of calcium in their bones. Make sure that the calcium is supplemented with vitamin D. You want to do that because otherwise that calcium is not going to be absorbed into your system as it passes through the small intestine. Weight-bearing exercises. Even if you have osteoporosis, you still want to try to do weight-bearing exercises, which forces your body to remodel your bones to become stronger. Do hormonal therapy, especially in case of women. Increasing the level of estrogen could help you slow down and then eventually reverse the activity or the effects of osteoporosis. Do note that hormonal therapy in general is controversial because in women, it does increase the risk of heart attack, stroke, and breast cancer. So if you typically have a history of breast cancer in your family, they do not recommend they don't recommend the hormonal therapy for that individual. So that's about it. Please do note that even though I only talked about osteoporosis, there are other conditions that are associated with the skeletal system, but that is as far as I would like you guys to go. We'll continue the next PowerPoint on joints. We'll keep that PowerPoint very short, but I do want to spend some time discussing the knee joint with you and looking at some of the medical conditions like cartilage tear, dislocation, osteoarthritis, rheumatoid arthritis, etc. So keep tuned for the joint lecture for our next lecture.